proud. So can you please tell me about our next patient that you just saw?
Yes, I saw AD, who is a 55-year-old Caucasian woman. She's alert and oriented and asks and responds to questions appropriately. She's in here today for low back pain, complaining of stiffness, which started about 2 weeks ago. And she describes her pain as dull and achy, but also shooting pain down her left leg. And it has increased over the last 2 to 3 days. And she is saying that the pain gets worse with certain activities like getting out of bed, getting in and out of the car, and bending over, changing positions, and even with coughing and sneezing. And pain seems to increase when she's standing for a long period of time, 10 to 15 minutes, and decreases with rest or when stretching or taking ibuprofen. So she is taking ibuprofen currently on and off, but the pain still continues. Prior to ibuprofen, her pain is 7 out of 10, and after taking ibuprofen, her pain is 3 to 4 out of 10. So she's actually never pain-free. She's never experienced this type of pain before. This is her first time, and according to her, it is continuing to get worse. Okay, some of the pertinent negatives are that she denies any bowel or bladder incontinence or any paresthesias. She denies any past problems with joints, muscles, or bones, denies any recent weight gain or loss, denies any family history or of rheumatoid arthritis, gout, or osteoporosis, and denies any sickle cell anemia or lupus in the family as well. Her immunizations are up to date. She is postmenopausal and not taking any estrogen replacement therapy. She does walk 3 times a week for about 30 minutes, and she's able to do that quite successfully. She denies any use of tobacco or alcohol, but does consume 3 to 4 cups of coffee every morning, and does drink cola throughout the day, about 32 ounces of Diet Cola.
Mm-hmm.
Her current medications are calcium with vitamin D supplements 2 times a day, and ibuprofen 400 milligrams and as needed, but she does say that she usually takes it about every 8 hours as needed.
Okay.
And her occupation currently does involve her she works for a local factory on an assembly line where she's lifting small parts and placing them in a motor, so it does require her to stand all day, and she does get a 15-minute break and a 30-minute lunch break. Her work also requires her to wear steel-toe shoes all day. She denies any difficulty with EDLs, and she does not require any assistive devices for mobility. And she denies any change in body image or self-esteem. So I did do a quick assessment on her, and just by inspection, her posture is erect and straight, movement is coordinated and rhythmic. She is able to stand on toes and heels. Cervical and lumbar spines are concave, and thoracic spine is convex. She's able to swing her arms in opposite directions. Palpation, cervical, thoracic, and lumbar spinal processes are non-tender. Lumbar paravertebral muscles are firm and tender bilaterally. With lumbar spine, she is able to flex. Flexion has decreased to about 60 degrees, and lateral bending has also decreased to about 25 degrees, and she is quite guarded when she is doing lateral bending, especially to her left side, and that is the side that she reports the shooting pain going to.
Okay.
Hyperextension is normal at 30 degrees. Rotation is decreased at about 20 degrees bilaterally and reports quite a significant discomfort. Her straight leg test is positive, and both her legs are equal in length. And her lower extremity, upon testing for her extension, she's able to extend, but she does demonstrate mild weakness. Especially with that left leg, is not as strong strength. And so that's AD.
Okay, excellent. So that was an excellent assessment. You were very thorough, so thank you for that. What are you speculating about this patient? What do you think might be going on?
Because she is requiring to do a lot of side-to-side turning at her job, and she's been doing it for some time, and she is standing all day, and she's having this severe lower back pain. So I'm thinking it could be a nerve pinch, radiculopathy, or sciatica, or it could go as far as herniated disc. So I'm thinking we should start off with definitely we'll tell her to continue taking her ibuprofen. She is only taking it every 8 hours, so I would tell her to, she can take it every 6 hours if she needs to. Maybe try some hot cold therapies, and continue with the stretching if that is helping her with relieving some of that pain. And we'll definitely tell her to keep her walking, not to kind of freeze. And in the meantime, to get a better idea of what's happening, I think we should possibly do an x-ray or a nerve conduction test.
Okay. Do you want to do that right away, or do you want to get her to come back and for a follow-up visit?
I'm thinking that because she's had this for 2 weeks already, possibly we can get her to do this right away. And I don't want her to be through more pain. And start with the nerve conduction and x-ray, and if we see anything, go from there. And maybe if there is anything we need a better visualization, we can do that through a CAT or MRI scan. But definitely if she continues with her ibuprofen and the stretching and the hot and cold therapy, it may be that she may not need further follow-up if it's just a nerve pinch. It does take some time to heal.
Perfect. Excellent. Let's go and assess the patient.
Perfect. Thanks.
Thank you.